And on behalf of Reach from India, we're really delighted to be part of this launch webinar and work together with fantastic partners and build on the previous work that FTCC 1.0 partners have done as well to really strengthen community-led response to drug-resistant TB globally. I think many of you, for those of you who don't know about our work, if you could just click on the slide, please, till all four. Yeah, right through. Thank you. So Reach is a 26-year-old organization based in India. We've been working with the private healthcare sector, with the TB program, of course, providing direct care and support, but also working very closely with TB-affected communities, particularly TB survivors. And in India, for this particular work with TB Alliance, our starting point is a large cadre of empowered, committed TB champions that Reach has been working with since 2016 and is now a movement across the country today. Stop TB, of course, has played a major role in making this possible, and I'm happy to share a little bit more about this later if we have time. Through this particular project, we have an opportunity to add a layer of, to the work that champions are already doing, add a very specific focus on DRTB. I think in general, there is this idea that if TB is thought of as biomedical and complex, DRTB is all the more. And I think the work that we're going to be doing really presents an opportunity to change this notion, to show that communities can be thought leaders when it comes to drug resistance as well. Next slide, please. So what we're planning to do over the next 10, 11 months is we're working in 5 DRTB high burden states in the country. And we really have a 2-stage approach. The first is building community capacity on drug-resistant TB, understanding the new regimens. This is a great time to be doing this. The shorter regimens, VPAL, VPALM, have been formally adopted. They're being rolled out. Health system capacity is being built. And in tandem, we're able to build community capacity. So we're training 100 TB champions from these 5 states to understand drug resistance, understand the treatment regimens, why these matter so much to people with DRTB. Some of our TB champions, of course, are DRTB survivors themselves. And once they trained, that's when the second stage comes in, and they'll be doing that 2 work pathways in a sense. So one is in the community itself, building community understanding of what drug resistance is conceptually, what regimens are available for DRTB, what diagnostic cascades are there, and what communities can and must have access to. So just building that knowledge in communities, in their local communities. And second, at the sort of facility level, where the starting point is someone who's already been diagnosed with DRTB and is going to be treated through one of the shorter regimens, VPAL, VPALM, based on the assessment. So what is that person's experience going to be like? How can the TB champion play that peer support role? Of course, while keeping, looking after themselves and ensuring that they don't, making sure self-care is a major part as well. And finally, through this process, we're really hoping to document all of this, document the experiences of TB champions and document the experiences of people with DRTB whom they support, because I think this is a great opportunity for all of us to learn when BPAL is being rolled out, and not both in country and globally. Finally, I just want to say that, you see all these numbers on the slide. 100 TB champions will reach out to 43,000 plus people. But I think fundamentally, what's really important for us, and Sandeep alluded to this earlier when he spoke, is that fundamentally, we know that TB champions can help people get diagnosed sooner. We know that they can advocate for for access to upfront testing, for NAT. We know that they can provide that really invaluable emotional support to help someone with DRTB complete treatment. This is at an individual level. At a program and system level, what we're really hoping is their efforts will not just improve knowledge of DRTB, but also help reduce delays in diagnosis, reduce LTFU, improve treatment outcomes, and end of the day, reduce mortality. I think that's really our mutual goalpost, and it's TB communities who are best positioned to lead these efforts. I just want to end by saying a big thank you to TB Alliance for investing in communities, particularly at a time when the landscape of global health funding is dramatically changing, and we're all worried that engagement of communities will once again not be a priority. So this is a great opportunity for us to show how important this is, and we're very much looking forward to the next 1 year. Thank you so much. Back to you, James.